Good morning, everyone. Today we are going to talk about tuberculosis. Also called tuberculosis, is a bacterial infectious disease caused by a bacterium, Mycobacterium tuberculosis. It mainly affects the lungs, but it can also affect other parts of the body, like the brain, spine, and kidneys, if it is not treated. TB spread through the air. When a person with active tuberculosis coughs, sneezes, faints loud, or even talks, tiny droplets containing the bacteria are released into the air. So, if another person breathes these droplets, they can become infected. However, if tuberculosis is not treated, it can become very dangerous and even cause death. That is what is important to know about
Causes and symptoms. Now, I am going to explain the causes and symptoms of tuberculosis. As we mentioned before, TB is caused by the bacterium Mycobacterium tuberculosis. It spreads from one person to another through the air, especially when someone with active TB coughs, sneezes, speaks, or sings. The risk of infection is higher in crowded places with poor ventilation because the bacteria can remain in the air for several hours. However, TB does not spread by shaking hands, sharing food, or touching objects than 2 or 3 weeks. Chest pain, and sometimes they may cough up blood. If these symptoms appear, it's very important to visit a doctor as soon as possible because early diagnosis helps prevent serious complications and protects other people from
prevention and interesting facts. Now I want to talk about prevention and some interesting facts about tuberculosis. There are several ways to prevent TB. One of the BCG vaccine, which helps protect children and people who are at risk from several forms of diseases. It's also important to keep rooms well ventilated because fresh air reduces concentration of bacteria in the environment, covering your mouth and coughing or sneezing, washing your hands regularly also help reduce the spread of germs. Another important way tuberculosis prevent is through early diagnosis and proper treatment. When people receive treatment of time, they stop spreading the bacteria and have much better chance of recovering. An interesting fact is that most tuberculosis deaths occur in Africa and Southeast Asia, though exist over the world. Some regions are more affected because of poverty or overcrowding and limited access to healthcare.
Finally, I will explain the impact of tuberculosis and conclude our presentation. Tuberculosis is still one of the most common infectious diseases in the world. Every year, millions of people get sick and many families are affected. The good news is that tuberculosis can be treated and prevented. We can help be learned about disease, kind of the symptoms, going to Dr. Early and supporting vocation. If I work together and spread awareness, we can reduce infections and save many lives. Thank you very much for your attention.